And welcome back, Mzansi. Of course, we are always bringing you the best conversation. And let's take another big box in health and talk about cancer, which affects all of us. And I think something that all of us need to really understand when it comes to what's going on in this world. Now, today we are joined by two incredible experts, Laura Johnston, the CEO of Phytoceutics, as well as Dr. Lisa Dalmeyer, an oncologist at Southern Oncology at the Vincent Pallotti Hospital in Cape Town. And they're here to shed light on early detection, treatment options, and the role of supplements in supporting cancer care. Firstly, ladies, how are we doing this morning?
Good, thank you.
Yeah, listen, this is something that I know affects so many of us, either directly or indirectly. And what I'm noticing of late is that there seems to be a bit of a shift or a change. And I don't know if this is true and apparent, but in the past, cancer almost used to be associated with older people, so to speak, adults and those that have kind of lived a life. But now I'm seeing that it seems as though youngsters are being affected by it. Or is that just the case of us being able to diagnose these issues earlier than we were in the past? Doc, what's going on here?
So this is a question we get asked a lot. And I think, you know, for those of us who deal with cancer and treat cancer, it's our experience as well. You know, there are younger people being diagnosed.
Yeah.
I think the reality is that there's just more of an awareness of cancer. And I think our screening protocols are so much better. Social media has made a huge difference. You know, our population is also growing, so obviously we have to consider that. But I don't think we can say that it's become more common. I think it's just that we are more aware and better picking it up earlier, which is obviously also better for treatment and treatment outcomes.
When should we be screening? How often do we screen? And let's say we were possibly even diagnosed, do we continue with that screening as well?
So the thing is with screening, what true screening is that you're actually you are investigating a population that is not symptomatic. That's the true definition of screening. So if you have symptoms, that's completely different. And in South Africa, we actually don't have really good screening protocols. We often rely on, you know, the protocols that we kind of inherit from, you know, around the world. But I think the big ones that people want to know about, so breast cancer for women is a very common one. The protocols generally stipulate to screen from the age of 40. For men, it would be prostate cancer, and that's also from 40, so you'd go and have PSA test. And then probably the other big one would be colorectal cancer, where you go for screening colonoscopies. It used to be the age of 50, and it's now been dropped to the age of 45. And then also just to mention for our climate, you know, being in the southern hemisphere, we are very exposed to the sun, and, you know, our skins are quite high risk, so it's also important that you kind of have that looked at on a regular basis. But that would probably be the biggest kind of screening protocols.
Yeah, and I would urge, obviously, everybody to take an opportunity and go get screened because it could potentially save your life at the end of the day.
Absolutely.
One thing that's also becoming quite a trend in this space, and I'm sure with regards to contentious topics in oncology, and I'm sure you've read a lot of those, is alternative medicine.
Yeah.
And there's all these new fads coming through, new diets that we're always hearing about. With this world of alternative medicine, does it apply to the space that you're working in?
Yeah, it's a very difficult question, and we get asked it a lot. You know, our patients who are embarking on treatment, they want to know what diet they should follow, what supplements they should have. And to be honest, we don't have a clear answer. I generally say to my patients that, you know, I stay in my lane, and my lane is the science. And so we treat our patients according to trials and to protocols that have been based on evidence. But it's not to say that supplements and alternatives are not important. We just don't always know how they interact with our drugs, and that's the problem.
This is a great way for us to chat about what we do know. And Laura, when it comes to supplements, that's something that you know so well and so true. How do you think this fits into this world, especially for maybe patients that have been diagnosed? Is there a way that you can assist them in dealing with such incidences?
Yeah, so we work very closely with healthcare practitioners, and we don't interfere with their protocols. And we always say, speak to your healthcare practitioner before you embark on a supplement regime. So we don't get involved where there's chemotherapy, where you're undergoing radiation, chemo, and you know, pharmacological treatment. Where we get involved is where a patient's in remission. So there, you know, it's important to restore your bone health because chemo can take its toll on your bones. So taking things like magnesium, vitamin D, crucial for bone health. Then you've got supporting your immune system and specifically making sure you're not in an inflamed state because cancer and many lifestyle diseases are, you know, inflammatory conditions. So curcumin is an ingredient that has shown a lot of research in the remission phase as an anti-inflammatory and has shown a lot of promise. So this is something a lot of people will take when they're in their remission. But then, Lisa and I were saying it's also very important not to overburden your liver and your kidneys because you've been through so much already with your treatment protocol. So stick to the basics, speak to your doctor, and maybe pick one or two key things that you want to address rather than taking a whole bouquet of products.
Yeah, but the beauty is that there are options, right?
There are options.
All right, well, listen, this is a great conversation. Now, before we leave, I wanted to find out in terms of any parting tips, words of wisdom, and I know a lot of people are overwhelmed by this entire topic, and cancer is such an invasive thing for all of us, and it affects us in such a way. Anyone that might be going through some issues, wanting to get early detection, what advice do you have just in general with this space?
I'd say to people, obviously friends and family want to know what do we look out for. I think the important thing is listen to your body. If anything is not right or doesn't feel right, listen to it, because often there are signs that something is perhaps lurking. So I think don't ignore symptoms, rather go see your GP, go to the clinic, have yourself checked out. If you feel any abnormal lumps or bumps, don't ignore them, rather just have it checked out.
Well, enriching, educating, and this is what these conversations are about. So thank you, ladies, so much for doing exactly that. And I think if there's one thing to take away from this, it would be that early detection is a solid treatment plan, and supporting our health with the right supplements can definitely make all the difference. Now, the more we know, the better we can support ourselves and those we love. So for more on health and wellness, you definitely want to visit Phytoceutics.com.
Optimize your gut health with Phytoceutics range of pre, pro, and postbiotics. Use code EXPRESSO for 15% off at Phytoceutics.com.